Hello everyone, my name is LORENA RUDEŽ and I am a 6th year student at University of Zagreb School of Medicine, and I would like to tell you something about non-melanoma skin cancer in heart transplant patients. So non-melanoma skin cancers are the most frequent malignancies in all solid organ transplant recipients. The most common type of non-melanoma skin cancer in these patients are squamous cell carcinomas, and they tend to be more aggressive compared to general population. So regarding our patient, he was a 71-year-old Caucasian, and he has been admitted to the Department of Dermatovenerology with a lesion which you can see in figure 1. It was a crusty, scaly lesion which was located all throughout mid-scalp of his head, with the exception of the place where skin graft has previously been inserted. Before coming to our clinic, the patient has already undergone 3 surgical removals on his scalp. Surgical removals of this new lesion was no longer possible because of its size and localization, so radiotherapy was suggested as the treatment of choice. I would also like to stress out the fact that 11 years prior to his first dermatological examination at our unit, the patient has had a heart transplant, and because of that, he has been undertaking continuous immunosuppressive therapy. So the biopsies were taken from 3 different locations, which you can also see in figure 1, and the pathological analysis confirmed the diagnosis of squamous cell carcinoma. The whole affected area by squamous cell carcinoma was successfully treated by superficial X-ray therapy with a total dose of 6 degrees. The primary lesion healed adequately, which you can see in figure 2, where you can see the lesion right after the radiotherapy was completed, and in figure 3, you can see the lesion in 8 months follow-up. Unfortunately, in the following year, 5 more squamous cell carcinomas occurred throughout the patient's head and body, and all of them were removed surgically. So it is obvious that patients after heart transplantation are at higher risk of developing skin cancer in comparison to other heart transplant patients. They occur mainly because chronic immunosuppression can lead to decreased immune-mediated tumor surveillance. Surgery is usually the first-line therapy for squamous cell carcinomas, but in our patient, radiotherapy was administered because after 3 surgical removals, squamous cell carcinoma relapsed and spread throughout the scalp. So in conclusion, it is important to stress out that the management of non-melanoma skin cancers in organ transplant recipients should focus mainly on aggressive treatment of established malignancies, but also regular full skin examination by dermatologists or other doctors who do the follow-up on these patients, but also educating post-transplant recipients and providing prophylactic measures to these patients. Thank you very much, and if you have any further questions, please feel free to contact me.